During the pandemic, I learned a valuable lesson on the importance of staying connected with patients. We hired a person whose only job was to call and check on our sick COVID patients every day until they got better. Our COVID liaison, as we called him, would check with me every day and report how each patient was doing. If there was a problem, that allowed me to intervene quickly before things got out of control. In the 2 years of treating COVID patients with this model, we had 0 deaths, 0 people on ventilators, and that was really our secret to handling the pandemic. But it got us to thinking, could this type of model work for other medical conditions? And if so, how could we execute that and what conditions would benefit? The clear answer to that right now is mental health. Not surprisingly, during the pandemic, there's been a huge surge in the prevalence of depression and anxiety, and that's created a bottleneck in terms of the access to counselors and psychiatrists. In Central Arkansas right now, for example, it can take up to 6 months to see a psychiatrist. Baptist Hospital recently approached us to help pioneer a program that we see as a real solution to our access problem, and it reminds me a lot of our COVID liaison deal, only this would be for patients who have depression or anxiety or other mental health needs. So now we're partnered with a company called Mindoula that's been providing this type of service in other states for 10 years. If there's one silver lining that's come out of the pandemic, it's that the laws have relaxed so that we can do more telehealth and virtual care visits, which is sort of how this service works. Basically, they provide 24-hour, 7-day-a-week access either by phone or by FaceTime to a healthcare manager who can answer questions and give counseling and can pass along information to a psychiatrist who helps everybody in guiding your care. The great part about this program is that everyone is in communication. You are contacting them and they are contacting me, and there's a psychiatrist at the center of all this providing recommendations. So, for example, if the psychiatrist thinks that you would do better on additional medicine or an alternative treatment plan, they'll communicate that to us, and we're the ones that prescribe the medication. In a way, it's like getting an instant second opinion from a specialist. But the best part is that you have a whole team supporting you on this deal. The reason that we decided to go with this particular company is because they have a very good reputation and they have a proven track record. They have studies to show where 80% of people who work with them have resolution of their depression or anxiety within 6 months, which is pretty impressive. Okay, now I'm going to turn it over to our head psychiatrist at Baptist, Dr. Patty Gibson, who's going to give you some more details about the program. Take it away, Patty.
I'm Dr. Patty Gibson, and I wanted to tell you about a new partner that Baptist Health and your primary care clinician have to be able to provide you an access to behavioral and mental health consultation. It's so difficult to get into counselors and psychiatrists that we have found a great way to be able to provide our patients some evidence-based type of treatment that is called collaborative care management. Your primary care clinician office can give you a handout just like this that explains how the program works. But basically, this is a 100% virtual program in that your primary care clinician will make a referral to the program. The Mindoula intake person will contact you within a couple of days, will provide you information about how the program works, and talk to you about your insurance and what you might be expected to pay in copays. Then they'll set you up with a care manager who will do a more thorough evaluation, and they will meet with a psychiatrist who will also give some feedback to your primary care clinician about your diagnosis and any recommendations that they might have. If you need medication, your own primary care clinician will be prescribing those medicines and will be providing oversight for this type of treatment. This type of program has had great results and people getting better because they're able to talk to a care manager as often as needed. That might be every week or two, depending on what you and your care manager think is needed. They have 24/7 access via telephone, or they have a app or online. And this is 100% virtual. You don't need to go to any office, but you can talk with them by phone or by video. In addition to following up your response to medications if that's needed, they also provide some brief therapeutic interventions and support coping skills and based on what you might need specifically for your issues. It is paid for by insurance. Then the bill will be coming from your primary care clinician from Baptist, and it is billed on a monthly basis. Most patients who enter into this type of treatment may stay involved anywhere from 4 to 6 months, just depending on how they're doing and if they're getting the type of care that they need. So you can get an information sheet just like this from your primary care clinic office and explain a little bit more about the program and answer any questions. But this is a great program. We're happy to be able to offer you this as part of your care at Baptist.
So the way this works is if you decide that this is something that you're interested in, I place the referral today, and someone from the Mindoula company will be trying to get a hold of you within the next few days. Now, one thing that is real key here is they're going to call you from an outside area code. The area code is going to be 201, but they're real good about also sending a text message after they call explaining who it is, and then they'll also leave a detailed voicemail explaining who they are and how to get back into contact with them. Okay, thanks for taking the time to watch that, and I'll be right back into the room.